Dr. Kim Young-jin. Before watching the online surgical video, I'd like to briefly introduce the patient. The patient is a woman in her 70s. She made a visit with a chief complaint of severe gingival swelling and gingival excess around the mandibular teeth. As shown in the pre-operative panoramic image, the patient has only a few remaining teeth, which have been used to support a one-piece type bridge. However, due to severe periodontal disease and secondary caries around the bridge, extraction of all the remaining teeth is required. While placing multiple implants to support a fixed prosthesis can be an option, considering that the opposing dentition is a denture, we determined that placing 6 to 8 implants may not be necessary. In my opinion, this case represents the most appropriate indication for all-on-X. As you can see, especially in the posterior regions, such as the number 6 or number 7 site, the distance to the mandibular canal is significantly limited. Because of this, simultaneous implant placement in those areas may not be adequate. In some cases, even with GBR, vertical bone augmentation is needed, increasing treatment time and invasiveness. Placing 4 implants between the mental foramen with an all-on-4 or all-on-X prosthesis offers a shorter, less invasive alternative, enhancing patient satisfaction. I agree that, in the Korean patients, due to high occlusal forces, all-on-X treatment is not readily accepted in clinical practice. However, if the opposing dentition is a denture, I believe there is no reason to avoid all-on-X procedure. I always pay attention to the condition of the opposing teeth, and I tend to prefer mandibular all-on-X over maxillary all-on-X cases. Now let's move on to the surgical video.
10도 괜찮아.
4.5에 10으로 줄여드릴까요?
하나만 일단 내려주세요.
아까 12였고, 아까 4.5에 10이었고, 5에 8.5 있는데.
4.5에 10 줘요.
5에 8.5로 드려요? 4.5에 10이요. 4.5에 10으로 드려요? 네, 10이요?
As you saw earlier in the all-on-X procedure, it's common to raise a wide flap to identify the mental foramen and assess the angulation to determine the tilting angle of the posterior implants. In my case, I used a surgical guide. Using a guide helps accurately assess bone height and locate the mental foramen, making it easier to determine optimal implant angulation. As many of you may know, OSTEM offers two options for multi-angle abutments, 17 degrees and 30 degrees. If possible, align posterior implant angulation with anterior straight implants to maintain parallelism. Using a surgical guide during the initial or intermediate drilling helps in deciding whether to place the implant at 17 or 30 degree angulation because the subsequent drills tend to follow initial path. In this way, I aim to achieve as much parallelism as possible. Even when placing two implants in the anterior region, we consider that the anterior ridge is narrow. In such cases, to maintain parallelism and place the implants in ideal positions, I use a surgical guide for the initial or intermediate drilling steps and then proceed with implant placement. For the placement, the multi-angle abutments are connected first, followed by the temporary cylinders on the top of them. After suturing, we can prepare the temporary prosthesis in advance. You can see that it's possible to determine the approximate location of the holes in advance. If the patient had been wearing a denture, we would have made the holes on a denture-like structure with a flange. However, since this patient was previously wearing a fixed prosthesis, not a denture, we designed this one-piece PMMA temporary prosthesis with holes, but without a denture flange. After suturing, the temporary cylinders are connected to a one-piece provisional prosthesis. We'll take a look at those steps in the video on prosthetic part.
천천히 물어보세요. 같이 더 안 해도 괜찮으시겠어? 이렇게 보는 게 편해요. 밟으시고 몇 번 씹어보세요.
In some cases, the prosthetic process can be more challenging and time-consuming than the surgical process. Prefabricating the provisional prosthesis shortens the prosthetic process. Here, it's connected to the temporary cylinders, as shown with the screw-retained restoration. Once gingival healing has progressed, we can move on to the final prosthesis, implying that the multi-angle or multi-unit abutments remain connected to the implants permanently. All subsequent prosthetic procedures will be performed on top of those abutments. Since it is converted to an external connection system, the prosthetic procedures are expected to be easier, and the components are secured as shown here. This is the post-operative panoramic image. There were some residual foreign materials in this area which have since been removed. As you can see, we were able to place the implants while avoiding the mental foramen and even the anterior loop by evaluating the distance on the preoperative CT. On the right side, the implant placed in the number 45 site was positioned at a tilting angle of 17 degrees. On the left side, due to close proximity to the canal and limited bone height, the implant was placed at an angulation of 30 degrees. With this approach, we are able to order the appropriate multi-angle abutments in advance, which can be an advantage of the approach. So if you have a suitable all-on-4 or all-on-X case, I would suggest you can consider applying this method. That brings me to the end. Thank you for watching.